Hello guys, today we will speak about additional research methods of traumatological and orthopedic patients. How you understand, this is a second lection of all research methods, and if in last lection we talk just about physical examination, today we will talk about non-physical and more instrumental diagnostic. Okay, let's get started. X-ray diagnostics, it's the first method, is the leading method of research in osteology or orthopedics. With the help of radiography, it is possible not only to clarify the diagnosis of disease such as bone tumors, arthrosis, and the like, but also to monitor the dynamics of the development of the pathological process in bones and joints. And this real situation, because often we use X-ray not only when we want to understand have patient for example bone fracture or maybe he have a dislocation. Sometimes we use it in chronic disease of the bones. That means osteoporosis, osteoarthrosis. In Russia we delete this pathological process. In English and America you have just arthrosis. No, not arthrosis, you have arthritis, and that's all. In Russia we have two pathological, but young Russian traumatologists also tell that it's wrong, and older traumatologists also fun about them, but don't will do demagogues, just don't do discussion, just tell about X-ray. So with osteochondropathy, only radiologically it is possible to determine the stage of the disease and prescribe a treatment for patient. In fractures, X-ray examinations helps not so much in making a diagnosis as in clarifying the nature of the fracture, the direction of fragments, the location of fragments after reposition, and the course of the reparative process. And there you can see that oh, that's wrong X-ray. Sorry, I need to get it up to see bone fracture, but we will see any more bones and X-rays in this topic. Don't worry. Contrast arthrography. There you see arthrography of humors, and you see a white contrast. Not white. In X-ray it is black contrast. Black, but we see it like white. In disease and intra-articular injuries, contrast arthrography is often performed. For example, with congenital hip dislocation, contrast arthrography gives an idea of the shape of the capsule of the hip joint, the presence of soft tissue obstacles that interfere with conservative hip reduction. This method allows you to diagnose intra-articular injuries, post-traumatic hypertrophy of the parapatellar fiber, meniscus rupture, articular mouse. In inflammatory process, initial radiological changes in bones and joints can be detected 2 or 3 weeks after the appearance of the first clinical symptoms. And if the developed pathological process, the X-ray picture is typical for this disease, then early X-ray signs of the disease are detected only in comparison with a healthy joint or bone of the same name. Radiographs. One of the main conditions for the correct reading of radiographs is a thorough clinical examination of the patient in general and the site of the lesion in particular. Such a clinical study should proceed on X-ray. And of course you need to remember that diagnostic, clinical and radiological observation is considered the most complete if the orthopedic traumatologist himself masters the reading of radiographs and does not base his conclusions only on the data of the written conclusion of the radiologist. Numerous diseases, deformities of bones and joints have their own radiological symptoms. At the same time, there are also such common signs as osteoporosis, osteosclerosis, bone destruction, and others. Therefore, any radiological changes should be interpreted taking into account the anamnesis of the disease and the data of the clinical study. And now I want to show you few X-rays with osteoporosis, osteosclerosis and bone fracture. There you see a start process and you see that space between bones, yeah, intra-article space is normal. There you see that it smaller, and there you see that it go away, yeah, intra-articular space. Okay, this is osteoporosis, and there you see another bone, and you see how it begin. 6 grades, yeah, and you see big space, small space, and change of bone, small space and more change of bones, yeah. And there you see a big problem. It was osteoporosis. What about osteosclerosis? You see that bone will be harder, yeah. This is osteosclerosis. This case is using patient of one drugs. I don't remember, but you need to remember that any drugs can include to osteosclerosis. And the last picture is a bone destruction, and you see that we have some problem of bone, yeah, with bone. Okay, X-ray. X-ray computer tomography, CT. CT allows you to take pictures of individual layers of organs and tissues. In an axial projection helps to study the structure of bone matter, determine bone density, examine the condition of soft tissues, article cartilage, the walls of the spinal channel, build a three-dimensional image of the skeleton. Ultrasound scanning is the most informative when studying soft tissues. The ability of ultrasound to penetrate into the soft tissues of the body without significant absorption and be reflected from the seal in is used for diagnostic purposes. The study reveals tendon ruptures, effusion in the joint, proliferative changes in the synovial membrane, synovial cysts, abscesses, hematomas, and foreign bodies in soft tissue. Magnetic resonance imaging. The tomography clearly shows muscles, fatty layers, cartilage, vessels, spinal cord and brain, intervertebral discs, periosteum. Bone tissue does not give a magnetic resonance signal. are the methods for an additional objective assessment of the functions of the musculoskeletal system. The following biomechanical and physiological research methods are used. There you need to understand that all of these methods I never see in hospital when we talk about emergency situation, but maybe somebody use it in other situation, maybe no. There I forgot to translate. Podography. Yeah, podography is a technique for recording the time permanence of a step. With its help, it is possible to characterize the patient's gait, determine the presence and severity of laments, examine the state of rolling through various parts of the foot. This method allows you to easily and quickly assess the main static kinetic changes of walking to trace the dynamics during treatment. Tensor podography. It's like podography but have some changes. Along with time, the lower characteristics of the step, the distribution of pressure between the heel and toe of the foot during walking are also recorded. The technique allows you to more accurately assess the gait, identify the features of the distribution of pressure on the foot and its departments. Electromiography is the registration of electrical potential now of a muscle using cutaneous or needle electrodes. It is used to fully study the functions of the muscle, its participation during the performance of various movements. Electromiography allows you to orient yourself in the nature and degree of damage to the neuromuscular system to determine the place of damage. Simulation electromiography is a question and registration of evoked potential from muscles and nerves. With its help, it is possible to determine not only the nature and degree of damage to the neuromuscular system, but also to accurately detect the place of damage in the reflex area, to investigate the speed or propagation of impulses through the nerves, the function of synaptic transmission. Railwaysography is a technique for recording the total resistance of any part of the body when a high-frequency current passes through it. With its help, a non-invasive study of blood circulation is possible both in some organ and in a certain segment of the limb. Supplemented with medical tests, for example, nitroglycerin, it allows you to identify not only the nature of blood flow disorders decrease or increase, but also the causes, spasm, compression, or parism of blood vessels. Polarography is a method of studying oxygen tension in tissues. With the help of special electrodes, it is possible to determine the amount of oxygen voltage both in the pathology zone and in the surrounding tissues. Osteoscintography is radionuclide imaging of the skeleton. The method is carried out using osteotropic radiopharmaceuticals administered intravenously. Their inclusion in the bone tissue reflects the state of blood flow in the bone and the intensity of metabolic process in it. The gamma radiation of a radioactive label is recorded by a gamma camera and converted into a visible image. The moving table of the gamma camera allows you to visualize the distribution of the radiopharmaceuticals throughout the skeleton. Normally, a relatively uniform and symmetrical accumulation of radiopharmaceuticals in the skeleton is noted. In case of tumor metastasis, hot foci, hotspots are detected. In right picture you see a normal and then osteoscintography with metastasis. Hyperfixation of the radiopharmaceuticals is detected in the fracture area with osteomyelitis, arthritis, primary malignant bone tumors. And in left picture you can see a hyperfixation. A local decrease is the concentration of the radiopharmaceuticals is observed with aseptic bone necrosis. I don't find a picture with aseptic necrosis, sorry. Next one is diagnostic arthroscopy. Allows you to examine all parts of the joint, assess the condition of the synovial membrane, articular cartilage, identify free cartilaginous bodies, take pathological tissue, synovial fluid for histological examination. Arthroscopic, despite its high informativeness, is carried out the final stage of examination of patients if the diagnosis cannot be clarified using clinical and paraclinical methods. And you need always remember that arthroscopy is operation, is surgeon, and it's like laparoscopy, yeah? the same operation. Be worried with it. Morphological examination in orthopedics is performed for many diseases of bones and joints. In patients with malignant bone tumors, it is used to clarify the preoperative diagnosis and to resolve the issue of the scope of the proposed surgical intervention. For the purpose, a biopsy is performed puncture if the tumor is located in hard-to-reach places. As a rule, it is performed before surgery. More often, they resort to an open urgent biopsy, and upon receipt of the result of a morphological examination, determine the scope of the operation. A biopsy can also be obtained with diagnostic arthroscopy. And the last one about what I want to tell you, this is a laboratory research. In addition to conventional studies, general blood and urine tests, biochemical analysis in a number of patients give an idea of a particular disease. Biochemical blood testing is especially important in the diagnosis of bone tumors, inflammatory and specific tuberculosis, syphilis, as well as concomitant diseases. Biochemical studies are important for controlling the course of traumatic illness in mechanical, thermal, and radiation injuries. They cannot be dispensed with during the preparation of the victim for surgical treatment. Of patients, of course. Sorry. And that's all. Thanks for your attention. Don't forget to subscribe on my Instagram and on channel. And please be careful. Don't have any trauma. Yeah. In next time we will talk with you about dislocation, and I think it will be more interesting for you. But remember that, for example, X-ray and CT scan in this topic of orthopedic is very important for you, and you need read X-rays films. Okay, thank you very much for your attention. Bye bye.